All right, our guest speaker today, Patrick Carnegie. He's been in the community a long time doing great things. He brings well over 25 years of community development experience at a large CDC. MCR Health, it has grown by leaps and bounds. I was there when we were auditing, when it was just a small little operation, not much going on. And it has just blossomed. It blossomed under Mickey Prochet, and then Patrick has taken it a whole nother level out there. More than 40 healthcare centers, 3 mobile units, 19 pharmacies. It's a private, non-for-profit healthcare system. One of the largest or the largest in the Southeast region? Just amazing. They do family practice, internal medicine, pediatrics, OBGYN, behavioral health, vision, dental, and many other medical services. Without further ado, our speaker today is Patrick Carnegie.
Good afternoon, everyone. And thank you so much for the opportunity to be here. Before I start, you guys mind if I take this off? I have to just say really thank you so much for the support for the club this afternoon. To me, what a wonderful surprise. Like she said, I've known her for quite some time now, and she's always had a heart for the community, and I'm so thankful for what you're doing here at the Performing Arts Center. Excuse me. Just real quick before I get into the presentation today, I must tell you guys that the ones who don't know, I'm born and raised here. I'm a Bradenton boy, so I'm proud to be back here in the community working. I mean, I never had an idea that it would happen that way, of course, but I'm so thrilled that I have. And Kiwanis is really near and dear to my heart. I grew up, going to the 13th Avenue Community Center as a kid, and, really understanding the history of the community center. And it started back in 1937, and there were some great teachers that came out of the program, a lot of great athletes that you guys know, professionals here in the community, but in about 1950s or so, I believe it was, we understand the history of it. It was an organization here that contributed the dollars for a really nice building at the time, and that was, guess who? The Kiwanis Club. And so we've always been, real thankful for that contribution from the Kiwanis Club, and I've just seen the great work, over the years that you guys have done in the community, and I just can't thank you guys enough for what you do. And for the people that are out there in the trenches getting it done every day, that support is invaluable, and we really couldn't get it done without that. Just real quick again, another little real brief. Again, my family's from here. My grandfather started a little barbecue restaurant here a long time ago. He started out cooking at the church, and it had a connection to Kiwanis. It was called J&J Barbecue. So we used to actually provide some of the lunches over at the site over at the trailer park over there. So I really do, have some fond memories of Kiwanis, and so I want to again thank you guys for all that you do. I have 2 of my great wingmen here. What we do is not work every day; it really is a passion. And so I've got Dr. George Van Buren, who's my Senior Vice President of Medical Affairs and our Medical Director. I believe he'll be, this is his 34th year at the company. So he's a giver, and Dr. Bill Colgate, also one of my right-hand guys that does a phenomenal job with our ACO and a lot of other things in the community. So moving right along, I know we're at lunchtime here, so I want to get right into it. First, just a little bit. Neil did such a great job about MCR. I don't have to spend much time here at all, so we can kind of continue to roll right through. I didn't bring a clicker here, so I thank you, Janine, for helping me out. As you can see, this is 1979 we started, and it really started out in Parish in the old schoolhouse building. And a group of citizens got together and said, hey, we need to come up with a federally qualified rural health center to help the underserved population in the community. And as you can see, all of the offerings that we provide, of course, the big part of that is primary care, but all of the other specialty care that we provide is so important as well, and I'll speak a little bit about the specialty care here in a second. Actually, the explosive growth that you heard about with Neil, just about 3-4 years ago, we were at 28 locations, and now you can see we're at 47 health centers. Also includes the 3 mobile units, 19 pharmacies. And we'll talk about how important that 19 pharmacies is and some of the things that we do with that. But you can see we've expanded now with our just primary business model into a 6-county footprint, which of course the biggest is Manatee, followed by Sarasota, DeSoto, Pasco, Hardee, and Lee counties. And I won't spend time reading, you know, the mission here, but you guys know that we have a passion for the community, and we're really serious about delivering on our service vision. As you can see there, an exceptional experience to everyone every time. And the deal is this: we don't care how much money or how little money you have in your pocket. We believe that quality health care should be available to everyone. And so we really work hard to make sure that those experiences are exceptional for everyone when they come. All right, I wanted to introduce you guys to, you know, my guiding coalition, if you will, my CET, Senior Executive Team there, which 2 of the guys here in the room, but a well-diverse group of people there from our medical director all the way down to our HR, VP, etc. All right, this is what I'm really proud about. I can stop at this one really after this. This really gets me going and excited. $59 million in charity care last year alone is what we provided to the communities, if you will, unreimbursed care. Yeah, thank you very much. So going back to that first slide, you remember when I mentioned, you know, primary care is really the core of what we do. And I talked about the specialty care piece, right? So, you know, you imagine someone comes into your doctor's office and, you know, the primary care physician diagnoses them with something. They need to see a cardiologist or a GI, a pulmonologist, etc. But they don't have any insurance. They don't have any resources. They need to do it, right? So what we figured out is a model to be able to bring those services, even all of the specialty care, underneath our umbrella. General surgery, all those things that even the uninsured would need, that before that really wouldn't have access to those services, and especially not right away. And so when you see that big number of 59 million in charity care, a lot of that has to do with all of the different specialty care that we provide to those populations as well. So it doesn't just start with primary care. Great team of employees and independent contractors. You know, again, there are about 1,250 people that help us get this done every day. So I'm very proud of the work we do. Last year alone, we serviced 142,000 individuals last year. 142,000 patients, 655,000 plus visits in 2020, even in the COVID year. And right, we talk about the uninsured, but what we understand is no margin, no mission, right? So we have to generate revenue to be able to do all this great charity care that we talked about. And so the better we do of taking care of our commercial insurance patients, our Medicare patients, the more we have in resources to be able to take care of the underserved. And so with that being said, we accept over 113 insurance plans, including Medicare, Medicaid, and commercial. And about 20% of those patients that out of that 142,000 are uninsured. Now that's not included the underserved, which is the Medicaid population. So about 50% of the population falls in that Medicaid uninsured category. Quality. Number one, right? First thing is quality. So we've decided to say, hey, we want to be accredited. We want to make sure that we're performing care, you know, providing care to the highest levels, highest standards in the industry. So we said, hey, we'll pick the toughest accreditation bodies, and that's what we'll go and we'll seek. So ambulatory care since '98, home care since 2010. We are a primary care medical home that we've had that designation since 2014. And that's all through the Joint Commission, which is the gold standard for quality care. A very rigorous process that you go through to be accredited through the Joint Commission. And one that's even a little bit tougher, that we, believe it or not, than the Joint Commission is URAC. And we made this decision a couple of years ago as it relates to our pharmacy. So what the URAC accreditation does, it allows us to be able to fill specialty scripts. So specialty medications that patients will need, infusion services, those types of things, cancer treatments and other things that they need. Again, we need those things under an umbrella to be able to take care of the population. And so we went through that project to become URAC certified. We're one of the very few FQHCs actually in the state. There's only 2 others, and not every Walgreens or CVS that you see, they're not all URAC or specialty certified. We're one of the few. There are only a few throughout the regions, and so we're very proud of that as well. Another part of our business is all care options. Really proud of the work we've been able to do here, and it goes back again to that triple aim. We want to increase the quality, improve patient satisfaction, and reduce the cost. And so this is a program, and this is a separate company that we started in 2012. We were one of the first in the country to actually do this, and it covers an 18-county footprint throughout the state of Florida. We have 6 other participating organizations that are part of All Care Options with us, who we own and operate. And we service about 17,500 patients, as you can see, throughout the state in this particular program. This is only for Medicare fee-for-service, if you will, not patients who are part of Medicare Advantage programs, but people with just straight Medicare fee-for-service populations. And so CMS says, hey, you know what? We want to drive down the cost of care. We want to make sure people are receiving quality care. And you know what? We're going to do this experiment and say, hey, if you guys will save costs, we'll share in the savings with you. So, for example, if it costs, if CMS, based on your medical conditions, HEDIS scores, things of that nature, determine well, it should cost you $1,000, if you will, to take care of each one of these people in this population. Whatever you save under that, right, we'll share in those savings with you. And we've been able to save the federal government $89 million in this program. We were the 4th best performing ACO in the entire country last year. Another part of our business is our Huntington Behavioral Health division. I have a guy who leads that, Dr. Jim Horst. We're actually the largest provider of post-acute care in the entire state of Florida. As you can see, the different parts of the state, we service over 220 skilled nursing facilities throughout the state of Florida. And those guys do a remarkable job with that as well. And that's another one of our divisions. You heard a little bit earlier from Janine and Neil about our school-based piece, and a part of the contribution that you provided today. We actually started our first one at Southeast High School back in 2019. And so we have a center that's right on campus there as well. And we really wanted to do this because, you know, access is the key, right? I mean, what better way to have, you know, to take care of the kids if something happens in school? I mean, all of us who've had children in school know what happens if they become ill in school. You know, it disrupts everybody's day. And so what better way to, you know, be there and provide immediate access than to be right on campus? And so it's just been a thrill to work with the school district to get this done. And the one that you provided support for today is the Manatee Elementary School site, which is actually a community-based school project. And that's a partnership with a lot of different agencies. And so you can see the numbers that have been provided so far. And we started this again last year, mid-year. And even through COVID, we've been able to have some great success. And there's a lot of need in that school, and we even have a community medical location that's attached to that. So we actually have 3 portables there. One is for behavioral health, one is for just the students for their medical care, and then we also have one right outside of the fence for anyone in that community that needs access. COVID-19, right? I know that's the thing that we're really working hard to get past. And, you know, I want you guys to know that hey, we're built for this. We'll get it done. We will. We're built for it. We'll get it done. We're very optimistic. We're going to put all the resources necessary behind it to get through it. Just a little bit about our response to date. Of course, staff was first to try to protect that and the patients when they come in. And so during the outbreak, we instituted all of these safety precautions community-wide. We were able to really assist the county. We provided over 35,000 tests during the height of the pandemic. And we really had to get creative. I mean, there were, you know, visits were down, people were afraid to come into the doctor's offices. We also have a hospitalist program where we have hospitalists that's at Manatee Memorial Hospital 24 hours a day because that's our biggest inpatient census is at Manatee Memorial, so we do have that presence. So all of those numbers were down, things were down, and so because of what we've been able to do, again, no margin, no mission, relationships, we were able to pull together and put together our telehealth program right in the middle of the pandemic, and it afforded us to be able to continue to see those patients, continue to provide care. And we actually provided close to 17,000 telehealth visits throughout the height of the pandemic. As of April 4th, just wanted to kind of give you a few little facts and figures. 34,354 cases in Manatee County. It's compared to 28,000 in Sarasota. So you see that we have higher cases. But if you look at the next bullet, we've actually vaccinated less people. So we have a lot of work to do in that. Of course, there were some issues with distribution of vaccines and such. I'm happy to announce that we have solidified that process now with the Fed. So it's really been a good situation here in the last week or two to start receiving vaccinations directly from the Feds and the manufacturers. So we're in the process right now of ramping up and doing this in a big way, and you'll hear more about that coming up here real soon. We're in the process of developing an app so people can actually link onto that, come with their applications already filled out so that there's no wait, no appointment, things of that nature. We can just vaccinate masses of people at one time. So we're in the midst of getting that done. First thing we need to do is to make sure we can get a good supply of vaccines coming into the community. And so now with the help of the administration, we've been able to get that done. And we're really excited about what we're going to be able to do here in the next few weeks when we roll out our vaccination plan in conjunction with the county as well. And that'll be it. I know it's lunch. I wanted to keep it, short and sweet, and then open up for any questions that you may have. And I brought our two docs here just in case you guys wanted to ask anything that was really clinical and anything about how maybe the virus works or the vaccines or anything of that nature. Yes, sir.
Patrick, you mentioned 20% of the people are uninsured right now, or that you see. Is that number, that 20%, higher or lower than it was, say, 10 years ago?
It's consistent. Okay. We've started seeing a lot more people, so our payer mix is a lot, bigger than it was before. But what we've seen an increase in the Medicaid side. So that again is people who are 100% poverty level, and below. So when you look at both, it's actually gone up in the last few years. So it's about 50% of the population covers both of those.
Okay. And then one other quick thing. I'm sure you're aware Mickey Persay was a member of this club for decades.
I sure am aware.
We're offering that.
I was back there working in the trenches when he was at the Kiwanis meeting.
Well, we're offering that. We're making that offer open to you.
Absolutely. Thank you. I really appreciate it. I'd love to be a part.
So, go ahead, Jeff. Thank you. Patrick, in regards to the slides that you showed in Southeast and Manatee, and that you specifically have behavioral over there, can you, after only 1 year, can you say how that's impacted Southeast from a perspective of their students? And do the students feel comfortable? I noticed that there was more than 55 individual students who have actually taken advantage of the service.
Yeah, they're thrilled. The data we don't have yet because we like to go out a year, 2 years to see really the impact of the suspensions, missed days from school. But that's really our target. We want to make sure that those things are cut to a minimum. And so we're tracking those things every day. But the school is thrilled. Administrators work great with us. The kids love it. I mean, we're able to do sports physicals, the BHPs, all those things are right there, medications for the kids. So it's really started upgrading the behavioral health. We've noticed, and Dr. Van Buren can attest to this as a trained pediatrician, about 1/3 of the kids that we see all need BH. Yeah. Yes, ma'am.
Do you have a relationship with LECOM?
We do have a student rotation program with LECOM, so we in our dental program, and so that's the extent of that relationship with LECOM. And we service all of the hospitals, but Manatee is where we have our highest census, so we average between 40 and 60 inpatients a day at Manatee, and so we decided to have a full-time hospitalist program. And we also run the labor and delivery unit for Manatee, so we deliver, about 92% of the babies born in the county, and we run that whole labor and delivery unit 24 hours a day.
Yeah, kind of following up on Dave's question earlier about uninsured. The administration, I think, has done some things recently to try to make the Affordable Care Act even more affordable to those who are not in. Can you speak for a moment on what you think that impact might be?
Yeah, absolutely. We, unfortunately in Florida, we didn't expand Medicaid, right? So MCR alone, there's 20,000 patients, if you will. So you look at that uninsured number, there's 20,000 patients, and we had expanded Medicaid that would have had some form of payment. So they would have had some type of insurance. So what they've done to expand the criteria and the eligibility will be good in terms of having more people to have some type of coverage. And so we're looking forward to, seeing at least that Medicaid number go up where there's some form of payment versus being just no pays at all.
Thank you.
I've got two questions. The first one is, what do your doctors say to people that are afraid of the vaccine?
Well, why don't we ask one of them? That's why I brought him here. And I know we're gonna swing back here next after 5.
You can take the microphone off if you like.
And we'll both speak on this because both deal with it. But you tell them that the vaccine is a lot better than being dead, for starters. And then two, the complication rate is very low. What bothers them is they've had friends or family members who, after the second dose, occasionally feel horrible for about 2 days. But that's a sign that the vaccine is working because it's ramped up your immune system. So that's what's supposed to happen. So that's not a side effect or a complication. That's actually a sign that your body has responded as it should. And now that the variants and the other things are going to change, just like the flu vaccine. So we'll have to be agile as a country to kind of change how we produce the vaccines. But a day doesn't go by where I can go anywhere and not get asked that question. I've had both vaccines. I had COVID 14 months ago after flying to Boston to see my dad. And trust me, you don't want it. It was no fun. So that's part of the answer.
Okay, as Dr. Colgate mentioned, the vaccine is important. I've had my 2 doses, so the first thing I tell people is I've had it, so I'm still here. So that should say something, number one. A lot of people are hesitant about this because it came along so quickly. Pandemic started, and by December we had vaccines out on the market. Usually it takes about 10 to 15 years to get something like a product like this out on the market. However, what people don't understand is that the technology for the Pfizer and the Moderna vaccines, based on the messenger RNA, was actually around, sitting on a shelf, waiting for somebody to kind of put 2 and 2 together and come up with 4. So once the impetus came into play, they used this technology to be able to bring this home to people, okay? Now, there are a lot of people that are hesitant about vaccines, especially people of color, black and brown people, like me. One of the things I always tell them is that one of the individuals that actually had a hand in creating the Moderna vaccine was a black female named Kizzy Corbett, works with Fauci at NIH. She was actually the head of the coronavirus team that actually did a lot of the legwork to develop the Moderna vaccine, okay? And again, the other thing I'll tell people is that if you're not going to do it for yourself, do it for the people that you care about, okay? If you've been at home, you can't go out and see your family members, your grandkids, your kids, do it for them. So that way you have at least some protection, okay? Now, everybody's looking at the statistics and, okay, you got the Moderna, Pfizer, J&J, and these other ones. Get a vaccine, okay? It doesn't matter which one. It will protect you against this virus and the variants. And if you do get it, and there are some people that do get it, the illness shouldn't be as bad. So hopefully that answers your question.
If I could add one thing real quick.
Very close to the community and to the children. What have you seen has been the unintended consequence of this? And if you had an opportunity to go after one or two areas in the healthcare of our community, what would you focus it on? You mentioned
The
healthcare,
unintended consequence of
COVID. And all the inability for socialization and homebound. So obviously you already mentioned healthcare as being a big issue, but from a standpoint of, it's kind of like whack-a-mole. As we've gone through this, certain things have popped up, and y'all are right there in a very broad network.
One of the things, Byron, that it happens a lot is that we're allowed a lot of times the last people called to the table. COVID was a healthcare issue.
That's right.
But we made it an economy issue, a school issue, and all this. We put all these other things ahead of what the issue was. The issue was healthcare. It was a healthcare issue. And so we were kind of late to roll out some things and do some things, so that, we're suffering those consequences a little bit, longer than we probably would have if the healthcare people had been able to step up and really say, hey, these are the things you need to do, and this is what we need to do, and how we need to do it as a community to be able to get past this. And so I think whenever these things will come up in the future, we really need to make sure we get the healthcare people, the experts at the table first, so that we're able to figure out how to do it and deal with it best.
So the feds are pumping a lot of money into these states and then trickle down to the counties. So you should be at the table to try to give them ideas of where to put the energy. Right. So I would try to be there.
Right.
And make a hit list.
Right. Yeah. So we I'd like to tell people, kind of going back, what are you asking? There was some people the other day. So I said, well, tell me this: if I could offer you a product right now that will protect your house from a hurricane, bomb, or anything, 95 and 96%, would you buy it? They said, absolutely. So why don't you take a vaccine that can protect your body at 95 and 96%, right? You've got to think about, how you protect yourselves, how you protect the community. So we just can't message this thing enough, to say, hey, everybody get vaccinated. And so we're going to launch some social media things, as everybody's on that now as well, and really, get out and hit every corner of the county to make sure we get as many shots in arms as possible.
As you prescribe for MCR Health seems like just a phenomenal real-world solution to solve some of the healthcare issues we have. Has your model been adopted throughout other parts of the country, and if not, why not?
Well, not totally. It has. Yeah, so we're working hard to really, because you're right, the country has a built-in mechanism already to provide increased quality, increased patient satisfaction, and reduction in costs. And it's through this model with community health centers and integrating the primary care and partnerships throughout. Even on the drug side of it, the biggest cost in healthcare is what? Hospitalization and medication. Right? So we work hard to make sure we reduce hospital admissions, readmissions, and we make sure we get people their medications when they need it on time and provide that access. And so we're working hard, every day to try to partner and roll this out, in other parts of the state and other parts of the country. And it's just going to take us, continuing to just push, until we get it out in other parts of the community. Yes, sir.
What are the doctor's thoughts on our immune systems now that we've had a mask on for a year? Are we a little bit more susceptible to other things once we begin to take these things off?
I would probably say no, but here's a caveat. Every year we go through this thing with influenza. Everybody get your flu shot. Then we see a whole bunch of cases of influenza in the community because, again, not everybody gets their flu shot. Okay. This year, as a side effect or the whack-a-mole effect of wearing a mask, influenza cases have dropped. I mean, you don't hear about people going into the hospital with the flu, or you don't see them coming into the office. So, I think from that standpoint, There has been some benefits to wearing masks. Do I think we're going to be wearing masks forever? I would hope not. But again, if it helps to protect and save one life, it's probably worth it. As it relates to our overall immunity, as we're still not wearing masks 24/7, so we're still being exposed to things. And so the other things that we've advocated as physicians, the social distancing as much as possible, and hand hygiene. You can't wash your hands too much. And learn how to cough, and don't cough into your hand, cough into your elbow. Things we teach the kids. Those things are helping us to kind of improve our immune systems and not get us sick.
Great, thank you.
One thing, we have a lot of surgeons, right? They wear masks for years,
Right?
all the time.
Yep.
So most people out in the public that's wearing masks to protect themselves is not even close. And these guys have not had any issues. So when you're talking to folks, kind of think about that.
Sure.
These guys wear them all the time, every day, and in surgeries for 6 hours sometimes.
And also, most of the research and data on the vaccines, when it says 94 to 95% effective, most of that research was done on those that required hospitalization or landed in an ICU. It doesn't mean that it's 95% protective to keep you from getting COVID. But as was mentioned, your symptoms and everything else will be less. So I don't think we're to the no mask point yet. And as Dr. Van Buren said, and this is a really important point, the mask, distancing, hand hygiene, the influenza has just plummeted this year. And that's a difference maker as well for employers, for hospitals, for people's lives, because 30 to 60,000 people die every year just from the flu. So I wouldn't let our guard down yet. I hope that time comes soon, but not at this point.
One final thing, kind of pivoting back to Byron's question, some of the things that we are seeing as a not so good, outcome from COVID is all of the other health conditions that have come up because of COVID. So again, protecting yourself from not even, getting the viruses is very important because all of the other things, it was even an increase in diabetes because of effect from COVID.
Do you have any other questions? All right, thank you.
Thank you all so much for the invitation. We really appreciate it. Thank you all for the great work you do and the great contribution today. Thank you very much.
Oh, Patrick, you get to come back up. Bradenton Kiwanis lives by the golden rule. No, it's a golden ruler to measure your future success and MCR's future success.
Oh, thank you so much. Thank you, guys.
Thank you for Colgate, Dr. Van Buren. We really appreciate you sharing with us.